What is a bladder ultrasound for diagnosis? Imagine a simple, painless way to see inside your body without any needles or surgery. That's what a bladder ultrasound offers. It's a safe imaging test that uses sound waves to create pictures of your bladder and nearby structures in real time. This test helps doctors understand how well your bladder is functioning and if there are any issues. During the procedure, a technician places a small probe on your lower abdomen, over your bladder area. Usually, your bladder should be partly or fully filled with urine to get the clearest images. Filling the bladder helps the ultrasound capture detailed views of its size, shape, and wall thickness. The whole process takes less than an hour and is completely painless, with no exposure to radiation. A bladder ultrasound is especially useful for checking for problems like bladder stones, tumors, or structural abnormalities. It can also detect if urine is being retained after urination, which might indicate a blockage or nerve problem. This test is often ordered when patients experience symptoms such as difficulty urinating, frequent urges to go, pain in the pelvic area, blood in the urine, or recurrent urinary infections. Beyond detecting tumors or stones, bladder ultrasound helps evaluate conditions like urinary incontinence, overactive bladder, or enlarged prostate in men. It can also identify issues like bladder wall thickening or bladder outlet obstruction. Because it provides real-time images, doctors can assess how well the bladder empties and functions during urination. While bladder ultrasound is very helpful, it does have some limitations. Factors like obesity, intestinal gas, or abdominal scarring can sometimes make images less clear. In such cases, additional tests like cystoscopy, which involves inserting a thin tube into the bladder, or advanced imaging like computed tomography scans, might be needed for more detailed information. From a bladder health and bladder cancer perspective, ultrasound is a key first step. It can help detect early signs of bladder cancer, monitor ongoing conditions, and evaluate how well treatments are working. Its safety and ease of use mean it can be repeated over time to keep track of changes without exposing patients to radiation. Overall, bladder ultrasound is a valuable, non-invasive tool that supports accurate diagnosis and management of bladder conditions. It helps healthcare providers catch problems early and plan the best course of action, all while being gentle and safe for the patient. If you have symptoms or concerns about your bladder health, talking to your healthcare provider about whether a bladder ultrasound might be helpful is always a good idea.